Well, Harambee began, I think, as a vision away for nursing, particularly a school of nursing, to demonstrate nurse-led healthcare that would help an underserved, primarily African-American, low-income community move toward health equity. So it was a desire to improve the health, a desire to demonstrate nursing, and a desire to make some changes in the broader healthcare system. The community that we serve is a Smoketown, Shelby Park, and surrounding area of Louisville, urban Louisville. The morbidity here, the mortality was extremely high, and so there was a great need for some intervention, and it worked for nursing as a way to demonstrate to our students what nursing could be and should be, as well as to the broader community that had been medically dominated for years. We are directly in the community. You go out the front door and walk across the street, and that's Shepherd Square. That's a housing. That's where people live there. You go to the left on another street corner, and that's where the grocery store is, or was. And we have access to people. So we're right here in the community, and we're guided by the community. Within the last 3 years, it's been an influx of Somali Bantu population. There are 65 to 70 families, with each of them having 6 to 8 children that live in Shepherd Square and the Housing Authority buildings. The women don't read or write, but they're also not accustomed to accessing health on a prevention kind of level. And so many of the children are not receiving the immunizations that they could qualify for. And so it's been a real challenge for the community to know how to interface with them. And so we are in the process of working with the community organizers from the Somali Bantu population to engage them in health services here more and do outreach with them. So we had to close the primary care clinic. And that probably was one of the most painful things I ever had to do in my life, because we had built, for 10 years, trust of these people. We really had to abandon a population that we had struggled for 10 years to nurture and, say we would be there for them. You just had to turn them out on the streets, and we knew they didn't have the health care that they needed. And it was really tough for all of us. It was a really hard thing to do. I think Harambee now has many of the same elements that it had before we had to close our primary care panel. We are open 1 day a week right now. And we have a volunteer receptionist, and I have a volunteer registered nurse who works with us, who is director of wellness clinic. We have nursing students who are here with us, who supplement the services that we can get. So yesterday they were giving flu vaccine, but they were set up in the lobby right when people come in the front door. We found that's the best way to recruit people in for flu vaccine and that kind of thing. Just be visible, first thing you see when you come in. They were also doing blood pressure screening, doing education about hypertension, about diet, about exercise. And on another day they would be doing screen for blood sugar, diabetes, or might be asthma, or cholesterol, which is kind of our 4 areas. So they're doing health education and promotion right there on the spot with them. The community lives in a constant state of stress, so it's a stress overload. And so we've found a really good way to get people the emotional support and care they need is to integrate that when they come into the primary care or to the clinic for physical problems. The community advocates within the Somali Bantu population have been very eager for Harambee Health Center to offer health services here in the community. Virginia Bradford with the James Brown Cancer Center is now partnering with us to begin to educate the Somali Bantu population about the need for mammograms, breast and cervical cancer with them. Well, from the beginning, Harambee has been a program without walls. And one of the first programs that we found really needed us was Mazik Middle School, which is located in the Smoketown community. Every year they would turn away 100 or more students who would have to be sent home because they didn't have immunizations and they didn't have physical exams and those kind of things. So that was one of our first outreaches that has continued over time. We are going to build it back, and you know, I just really feel confident that we're going to. I mean, I just always have felt confident that we're going to. I just think things are right. We don't have any money. We have $50 a month right now, but we have a lot of support from a lot of people, from residents, but also a lot of organizations and leaders in there that are stepping up, you know, really concerned that we're able to do this. So I think we will. I think we're on our way.